Welcome to this video on acute otitis media, one of the most common pediatric infections encountered in clinical practice. We will go through the definition, causes, pathophysiology, risk factor, symptom and sign, diagnosis and treatment, and finally complication. So, acute otitis media defined as acute onset inflammation of the middle ear, usually of an infective origin, commonly encountered following an upper respiratory tract infection. Occurs at all ages, but much more common in infancy and young children. Let's first take a moment to review the anatomy of the ear and the middle ear before proceeding to the causes and pathophysiology. Here, the diagram for the anatomy of the ear. We have three parts of ear. We have external ear, we have middle ear, and we have internal ear. So, external ear involve the ear auricle and the external ear canal. At the medial end of the external ear canal, we have an ear drum or the tympanic membrane. The next part of the ear is the middle ear. Here is the middle ear. So the middle ear is an air-filled cavity within the temporal bone that houses the ossicle, aimed to transmit sounds vibration from the external ear to the inner ear passing through the middle ear cavity. Important correlation in middle ear anatomy, and it's worth to mention here, is the eustachian tube. Eustachian tube is connecting the middle ear cavity through its anterior wall to the nasopharynx. It's important to remember it because it plays a role in the pathophysiology of acute otitis media. Pathophysiology, as we mentioned, upper respiratory tract infection lead to the inflammation and swelling of the eustachian tube or eustachian tube, lead to blockage and obstruction. This eventually will lead to the hyperemia of the middle ear mucosa. Hyperemia, when take a time, lead to collection or transudation of the fluid and fluid collection in the middle ear cavity. If there is on top of that bacterial or viral growth, lead to production of purulent exudate, lead us to AOM or acute otitis media. We can divide the causes as viral infection, which is the most common encountered organism, as respiratory syncytial virus, rhinovirus, adenovirus, and enterovirus. Bacterial organism causes are Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. Risk factors. Usually, as we said, it's common in the infancy age and young children. So risk factor will be bottle feeding, attending nursery or daycare services, positive family history of ear diseases, age between 6 and 18 months, and exposure to smoking. Symptoms and sign. We can divide the symptoms into the symptoms in the infancy and symptom in older children and adults. So, in infant, the symptoms is mainly fever, ear pulling, irritability, and vomiting. In older children and adult, we have otalgia, simply ear pain, fever, patient feeling generally unwell, hearing loss, usually of conductive type, we called it conductive hearing loss. If the tympanic membrane bursts, the pain may suddenly improve, but the purulent discharge developing from that ear. Okay. Signs. So, before we discuss the signs of the acute otitis media, it's important to understand the normal anatomy and otoscopic feature of the normal ear. So here, let's take a look. This is an otoscopic view of the right tympanic membrane. So as we can see, we have normal landmark that consist of the lateral process of the malleus, we have the ampu, we have the cone of light at the antero-inferior quadrant, we have the normal pearly gray color of the tympanic membrane, which is transparent, and we have the upper part called parus flaccida and the lower part called parus tensa. Okay, so what the signs then? So the signs usually consist of the bulging tympanic membrane as it appear here. It's bulging, injected tympanic membrane with dilated visible vessels. The color changes from normally pearly gray to either red or yellowish and opaque depending of the stage of the otitis media. Usually in the early stages it's red and hyperemic, and lately it will transform to yellowish due to exudative fluid production. Also, we're gonna notice decreased mobility in pneumatic otoscopy. Okay, diagnosis and treatment. Diagnosis of acute otitis media is mainly a clinical diagnosis based on features and otoscopic feature as we discussed it earlier. Imaging and lab usually not needed unless complication arise. Treatment. Treatment is involve mainly analgesia as ibuprofen and antipyretic as paracetamol. We're gonna add oral antibiotic if there is failure to improve within 24 to 48 hours, if patients from the start are systematically unwell, or if the age less than 6 months. We're gonna start by oral antibiotic. A 10-day course of amoxicillin usually is the first line. If no improvement, we're gonna switch to co-amoxiclav. Okay. Finally, the complication usually arise if the acute otitis media left untreated. We can divide it into the intratemporal complication and intracranial complication. So, intratemporal complications are tympanosclerosis, which is white patches on the eardrum, usually resulting from the scarring, hearing loss, tympanic membrane perforation, mastoiditis, labyrinthitis, and facial nerve palsy. Intracranial complication, mainly meningitis, intracranial abscess, lateral sinus thrombosis, cavernous sinus thrombosis, or subdural empyema. Okay. Thank you for watching.